Everybody, we're just waiting. I'm just waiting for a couple minutes to let everybody get on. Happy Wednesday to everybody. I hope everybody's having a good week. It's about 5:02. Yeah, we'll give it another minute or so. But in the meantime, I guess let me just say hi to everybody. If you're returning, welcome back. I've gotten a lot of good feedback, and I hope you're enjoying the classes. And if you have good feedback and some things that you want to talk about or discuss or any feedback at all, I'm totally open. I want to make sure that these classes are informative, that you feel like you're getting a good amount of information out of them. Like we talk about each week, the goal, honestly, of these classes is to make sure that you all feel empowered. And when you're empowered and there's a good plan in place and you believe in the plan and the plan is well thought out and well organized and well structured, you're able to work the plan, and that's where you might need help, whether it's us or other facilities or what have you, but you may need help orchestrating the plan. But at the end of the day, if you feel peaceful with the plan, if you feel serenity, if you feel less anxiety, less fear, um, I, I think that's the goal. That's the best thing I personally think we could do for you, is teach you so you feel confident and comfortable in the plan, right? So I do a lot of research on. I'm a sports guy. I coached baseball for years. I played at a high level in college, and what I learned was the best of the best don't worry about the outcomes. What they worry about is the process. And if the process is super solid and there's a lot of attention to detail and you have the right people helping you with the process, it doesn't mean it's foolproof, but it means you can increase your chances of, in this case, healing to the highest level. You maximize your upside and minimize your downside. And that's how my brain works. So the entire course and classes that we're going to do, and it's going to take us a while to get through them. And I'll outline the future. I'll let you know what we're doing tonight, and then I'll outline future classes so you can understand where this is going. But I think if we do that and I do a good job with it, I think you're going to be empowered and feel a lot more calm about about the process. And to me, again, as corny as that might sound, I think it's super important. Having been through it myself, having watched family members go through it, I know the anxiety and the fear. And I finally, after all these years, feel very confident in the plan that I would do, which is what I want to share with you. Okay. So I'll say that every week. I know new people are on here, and I really want them to understand the objective, my personal agenda or objective for the class. So this week we're going to finish up pillar number 2, which, if you remember, and I'll go through the 4 pillars. I'm going to do a nice review for you all, and then I'll let you know what we're doing in the future. But pillar number 2 in the 4-pillar approach is how to kill cancer cells, how to starve them, and then how to create an oxygenated environment and why, and then also how to create an alkalized environment or less acidic environment and why that's important. So again, pillar number 2 is going to be all about how to attack this thing, right? How do we get rid of these cells that have formed? So that's pillar number 2, and we're going to talk tonight about things like ozone therapy and how and why that's relevant, the Endo Laser and what we use and how we use that and why we use it. We're going to talk about ultraviolet blood irradiation. We're going to talk about vitamin C and mistletoe and something called methylene blue, and some of the strategies that we have, again, to kill, starve, oxygenate, or alkalize the body. So that's going to be, and Dr. Connealy is going to be on again, and she's going to talk heavily about that. I mentioned the first week, gang, that there's things that I feel very comfortable teaching you. And then there's things that I know I'm not the expert, so I will pull in the experts when I don't feel as comfortable and it's not my lane, so to speak. And that's why you'll see different providers on here, different clinicians, if I'm not comfortable with things, okay? And that's the way we're going to organize the classes. So moving forward, we're going to do, again, pillar number 2 tonight. We're going to do pillar 3, which is the immune boosters, right? Next time. And then the majority of the rest of the class is going to be spent on pillar number 4. So pillar number 4 is the causes, right? We talk about the hurricane and the tsunami and the tornado that could be going on in your body. And you know, the fact that in other models of healthcare, they're not looking at what caused this problem to happen, right? So if you remember from a couple of weeks ago, we talked about free radical formation, right? We talked about fuel igniting this free radical formation, free radicals causing oxidative stress, oxidative stress causing the cells or the DNA and the genes within the cells to kind of dysfunction, right? So what should happen to a cell if it's damaged or it's old, it should go through cell death, called apoptosis. But if the genes are damaged, it won't go through cell death, which means damaged or old cells start to replicate out of control, those are cancer cells. And then those cancer cells, if there's enough of them, form tumors. So you have tumors, let's work backwards. Tumors, cells that have replicated out of control, damage to the DNA and the genes within the cell that create that, oxidative stress that cause the damage to the DNA, and these free radicals, right, that cause the oxidative stress. So free radicals, real quick, is an electron that's been removed from an atom, or an atom that loses electron or electrons. And now that cell is unstable. That unstable cell causes the oxidative stress, which then causes the damage to the DNA, cells replicate out of control, etc. Right? Well, something or some things had to have caused the free radical formation, right? So those things within pillar number 4 could be everything from inflammation in the body, which we'll talk heavily about. It could be what we eat, right? We eat say we eat 3 meals a day, seven days a week, 21 meals at least. For a lot of people, maybe it's a little less, maybe a little bit more. But the foods that we put in our body better be low on non-environmental or non-metal toxins like pesticides, herbicides, fungicides. Our meats, if we're eating meats, better not have a bunch of junk in them, right? We better be eating clean, organic as best we can to lower the amount of bad stuff that gets in our body. So if we get overwhelmed with what we're eating and bad stuff that we're eating, it's going to cause a lot of free radical formation, right? So what we eat is of utmost importance, and we'll have Liliana here repetitively towards the latter part of these classes to talk about the different diets and different eatings and the research that's out right now. The gut health is of the utmost importance. So one full class will be dedicated to gut health. One full class at least will be dedicated to the liver and the ability to detox. We'll talk about in a class bacteria, viruses, and fungal infections like molds, right? And mycotoxins from molds and candida. We'll spend a whole class on infections. We'll spend a whole class on non-metal toxins, on heavy metals, right? All these different things that if your body is exposed to these or have them in your body, the immune system is going to constantly be fighting those. Inflammation is going to develop. Free radical damage is going to be developed. And if that happens over a long period of time, it's going to start causing damage at the cellular level, and those cells will start replicating out of control, right? So those antigens or foreign invaders that I just mentioned are critical that we're able to identify in your body. And then if they're there, we have a plan to remove them, right? But then we also need to talk about stress, physical, emotional, or chemical stress. We need to be able to identify what testing can tell us if your stress, your cortisol and your insulin and things like that are elevated. We're going to figure out, is it emotional and what to do about that? Give you strategies for that. Is it chemical? Is it physical? And again, measure cortisol and insulin and hormones to see if they're affected from it. And then thyroid, we'll do a class on the thyroid. We'll do a class on blood sugar imbalances. We'll do a full class on EMFs, which are the electromagnetic fields, right? ionizing radiation and non-ionizing radiation. It's everywhere now. And those ionizing and non-ionizing radiations, especially non-ionizing, if they're too much, they're going to create massive amounts of free radicals, which then will create oxidative stress. So the class moving forward is going to get into each one of those causes, and we'll do a whole class on each one of those. And that might take us 15 weeks or so, whatever it might be. We're going to do it until I feel like we've gotten through pillar number 1, which is the testing. Pillar number 2, which is how to kill, starve, oxygenate, and alkalize the body, which we're working on now. Then we're going to work on pillar number 3, which is the immune boosters. And then we'll work on pillar number 4, which is all the different causes that may have created this pathway, right? This lineage of free radical damage to oxidative stress to damage to the DNA, and then cells that replicated out of control. All right. So we're really going to break it down. We'll go one class at a time. And I think you'll, when it's done, the totality of it, I think you're going to realize that the 4-pillar approach and how we do it here is by far better than anybody else. I haven't seen it even close, to be honest with you. And I study this stuff all the time. That's not telling you, hey, we're the best, like come here. I'm just saying, personally, I haven't seen it done better and more thorough. And my brain is very analytic, and it has to make sense, and it has to be thorough with leaving not many rocks unturned. So I feel comfortable now. I think I told you last week, somebody very near and dear to me just came in on Monday after having a lumpectomy and radiation. She's doing the Rgcc test. She's doing she did all her hormone tests. She's getting lymphatic massage. She's doing ozone. She's doing all these things now that are going to really raise her chances to prevent reoccurrence, right? So I feel comfortable enough that my best friends and my family would come here. So I feel now comfortable enough to share it with all of you. And so that's genuine, by the way. That's just genuinely telling you I feel like the answers are really, really good. So, okay, so let's go back and review. I'm going to pull up the PowerPoint, gang, and let's review the last couple weeks so we know, if you haven't been on, you know exactly where we're at and what we're doing. Okay, so I always talk about, let me back up. The staff always, the next day after these classes, we get a ton of calls. So the staff will come up to me and just ask me to explain things as best I can. So the questions are somewhat less, I guess, limited. Not that we want to limit them, but the more information I can give you, the better, right? So what I'd like you to do briefly is walk you through a patient experience, right? If there's a consult done, the first day, everything's, we ask for maybe 3 months of 3 to 6 months of your scans and your health history, if you will. And so we ask for that. The doctors, before you come in on day 1, review all of that extensively, and they already have an idea of what they want to do before you even get here. So then they meet with you. We get feedback. If there's an examination that's done based on what they're finding, they'll do that, and then they'll give you a plan. So the idea is here, they're going to do testing typically day 1. So let me make sure that we review some of the testing, right? So outside of here, there's probably MRIs and CAT scans and PET scans and things like that already have been done before somebody gets here, right? Now, we will repeat those if need be as well. But we'll also want to do testing that starts individualizing the care. See, this is where it makes most sense to me, where if we do what they call the Rgcc test, you see it here under number 1. The Rgcc test will test for chemo agents that you're most sensitive to, if chemo is a possibility, or low dose chemo. It will test for natural agents that you're most sensitive to. It will test circulating tumor cells, and it will also test for these medications that they call it repurposed drugs that we could use to starve the pathways feeding your cancer cells. So we get a lot of information from the Rgcc that we can start in about 3 weeks after your initial consult. We'll bring you back, and we'll review the lab findings from the Rgcc that really starts to specify or individualize the care, okay? The second test we'll probably do for most people is, let me see if I go back here, is Nagalase, okay? So I want to give you, I pulled these tests to give you an idea of what or how we specify things. So as an example, if Nagalase is elevated, it is an enzyme that is produced by the cancer cell that blocks your body's ability to attack it, right? So if that's high, we want to do strategies to actually bring it down. And so that's individualizing the care even more. Beyond the Rgcc, now we get into Nagalase, and then we look at PHI. If PHI is elevated, we definitely know your cancer is anaerobic. So that's why we would recommend ozone or hyperbaric or something like that to oxygenate the environment, to get it more aerobic, right? The D-dimer is a test that if this is elevated, we know you have a better chance of clotting, number one, but it tells that the cancer may be moving a bit. So we might have metastasis going on, which can help us identify or do testing that can help us identify if that's going on. And then your cancer antigens. So the point I'll make, gang, is the testing is done day one, most likely these tests, and then others as well. For 3 weeks later, when these tests come back or do come back, then we are basically making where a rubber meets the road plan mapped out for you based on that individualized testing, right? In the meantime, in that first 3 weeks, though, we want to do things that are going to help promote healing. We want to do immune boosters. We want to do detox. We want to get the ball rolling. So in the first 3 weeks, there might be an interim plan until we get the data back. And that's how this goes, right? So I thought it was important because we get a lot of questions. All right, well, what happens, on day one? What happens after that? So I want to make sure you understand, if you do ever decide to come here, the process. And then when the labs come back in like week 3 or 4, we then set another plan in place. And that plan, again, is the rubber meets the road. And that could go out 8 weeks or 10 weeks. And then there's measurables done at a certain time. We have to find out, the test, treat, retest mentality, if what we're doing is working. So then there's measurables. And so those measurables tell us, is it working? Is it not working? And then we can pivot based on those measurables. And when I say measurables, it's retesting, rescanning, things like that. So that gives you at least a day one, right? 3-week interim plan, week about 4 gives you the full plan, and then out maybe 8 to 10 weeks before we retest and remeasure. Okay, hopefully that makes some sense. But the fact that the testing is done to individualize the care is very special to this place as well. And that's one of the confident things I have confidently in it, that I know that my care is going to be different than somebody else's because of the individualized nature of these tests. Okay, it's not cookie cutter. All right, and that's a biggie. So the testing we talked about in when we did our week 1 class here. Then we talked about the whole oxidation problem, where you get free radicals, oxidative stress, and I already explained this. Then you get breakdown of the cells, that they start not working well, so that cells don't go through apoptosis or cell death, and then they replicate out of control. So then we talked about things that help overcome the antioxidants, right? Or I'm sorry, overcome the oxidative stress, which are antioxidants. And those are things like vitamin A, vitamin C, vitamin E, CoQ10, resveratrol, turmeric. Gosh, there's a number of them. Selenium is a big one as well. So we talked about all those antioxidants that, if you're not familiar, will donate the electron back to the unstable atom. So if an antioxidant donates the electron, that atom becomes stable again and no longer will produce that oxidative stress. So antioxidants are a huge, huge factor. Okay, so that was week 2. And then week 3, last week, or class 3, I should say, we talked about, personalizing the care. We talked about these repurposed drugs, okay, there's a book called How to Starve Cancer. Jane McClellan wrote it, and she talks about these different repurposed drugs that can block basically the feeding of the cancer cell. It can block different pathways that will help starve the cancer cells. So these medications that you see here, gang, are some of them are on the Rgcc that will tell us what you're most sensitive to. Okay, so that's a big deal. All right, so these are some more just repurposed drugs that we talked about last week. And again, that's pillar number 2 is kill and starve, and then oxygenate and alkalize. We'll talk more about oxygenation and alkalizing in today's class. So commonly used repurposed drugs, you see another list of them there. So again, the Rgcc test tells us as much as we can about how to kill and starve your cancer cells and what's going to work best for you. We talked a little bit about insulin potentiated therapy or low dose chemo. And basically the gist of low dose chemo is we're going to take the chemo agents, if this is relevant, we're going to take the chemo agents from the Rgcc that you're most sensitive to. We're going to say you came in on a Wednesday. Today's Wednesday. We had IPT this morning. They are going to lower your blood sugar. So they're going to give you insulin to lower your blood sugar into a therapeutic range, could be around 40 to 50 roughly. And once you're in that range, they're then going to infuse the chemo agents into your bloodstream. And what that does is it kind of acts like a heat-seeking missile, where the chemo is going to go right to the starving cell, basically, and it's going to act on that cell, but keep the surrounding cells intact. So conventional chemo just kind of kills everything, right? Well, low-dose chemo is more targeted. So not only do I get less, or I get specific chemo agents, right, that are more targeted for you or specialized for you, I can start targeting the cell better, which means I need less of a dose. So typically we'll do 10% to 20% strength of the chemo and use less toxins to do the same job. So that's something that a lot of people want to do. They don't want to go through chemo. And I'm not saying chemo is bad, by the way. Chemo, radiation, or surgery in the conventional model, sometimes they're absolutely necessary. But this is an option for people if they don't want to go through the nausea, the severe breakdown of the body, and the hair loss and such. So low dose chemo we talked about last week. It's something that we use quite often here. Okay, hyperthermia we talked about is a basically heating. Now in other countries they have full body. We can't do full body. We can, in America, we can only do targeted. So we have targeted hyperthermia, brings the heat within the cancer cells way up, roughly about 107 degrees. And that is known to kill them, right? There's a ton of studies on that. So we'll do targeted hyperthermia with patients. And this is one that I recommend most of our patients do because the research is so strong on it. So hyperthermia was something we talked about last week. High dose vitamin C, 2 advantages to high dose vitamin C. Number one of the advantages is it boosts your immune system significantly. And the other advantage is the research shows that actually kills cancer cells. So we utilize high dose vitamin C often, okay? So that we talked about that last week as well. We talked about hyperbaric, which we're going to talk a little bit more about today. If you remember in pillar number 2, we talked about starving, killing, oxygenating, and then we talked about alkalizing. Well, in pillar number 2, let's go back to pillar number 1. If testing shows that your PHI is elevated, we are going to recommend hyperbaric or ozone therapy, which Dr. Connealy will be up in just a minute, and she's going to talk heavily about ozone therapy because we want to create an oxygenated environment because cancer thrives if your PHI is high anyway in an anaerobic state, which is low oxygen. That's not good. So we want to bump your oxygen content up. Hyperbaric is a great way to increase systemic oxygen. So that's a really good tool, and we talked about that last week. We'll talk in a minute about total body ozone when Dr. Connealy comes up, but I wanted to share with you a couple things before Dr. Connealy comes up and we get back into this. Let me just X out of it real quick. Okay, so hopefully that was a good review. You understand what we did week 1, week 2, week 3. You understand the purpose of these of the course, which is to educate you. It's to empower you, right? And then you understand, our testing and why we test and how to specialize and individualize the care. And then we talk about the oxidative stress process and what really happens. What is cancer? We talked about that. And then we talked about some of the strategies to starve or kill the cancer cells. Okay. Tonight, again, we're going to talk about oxygen therapy, ozone therapy, endo laser, UVBI, methylene blue, and some of the other IVs that we want to do. So we're going to get into those as soon as Dr. Connealy comes up. But I did want to mention a couple things. I was reading over the weekend, right, about health and healthcare in America. And some of you have heard me talk about this. I know some of you on here that are my patients that I see kind of regularly and help out in the clinic. But I was looking at the health numbers in America. So interesting fact, 66% of all the pharmaceutical medications made in the world are consumed in North America. Yet we're only about 6 to 8% of the population, right? Think about that. So we consume almost 2/3 of the medications made in the world, and we're only 6 to 8% of the population. Not only that, there is also we have the highest rates of heart disease, stroke, cancer, diabetes, obesity in the world, right? And we spend more than $1 trillion in healthcare a year. That's right, that's trillion. So what I was gathering and looking at, and I've known this for years, but in America, we don't provide healthcare. You know what we provide? We provide sick care. This is not a healthcare nation, right? And unfortunately, the way we handled the virus over the last couple of years is the same concept, right? You heard me say this if you were on the last couple of weeks. The chapter, we might be getting one chapter, right, of cancer care in the conventional model, or one chapter of the virus care in this conventional model. But there's still 29 other chapters to the book that need to be read and learned, right? And I parallel it. I say, I thought we were much further along, by the way. So if you think about vitamin D and vitamin C, and you think about quercetin, and you think about what else? C, D, zinc, right? And how beneficial they are to boost your immune system. And then you look at the doctors that are using hydroxychloroquine or ivermectin and the Z-Pak and zinc protocol together, and that the death rate that they're claiming is extremely low. And you just sit there and you think, why aren't we taught this? Why aren't we exposed to this? Why isn't this a national conversation every day? Well, there's a lot of reasons for that, right? But then you look at cancer care, and I compare the same thing. We're getting radiation, surgery, or chemo. That's the options. Yet when you learn the 4 pillars of the right testing, the right treatments of starving, killing, oxygenating, and alkalizing, you learn about immune boosting supplements and or strategies, and then you learn about the causes that created it. And you look at I've said this before, gang. You go, why aren't we doing this? Why isn't this mainstream? Those answers, whether it's the virus, or whether it's cancer care, or whether it's healthcare in general, I think personally, money has a ton to do with it, right? And I hate to say that, but I'm going to say it. I think the dollars and cents win, and that's a big part of why here in this class, I want to educate you and empower you so you understand all this, right? You get it. You're like, I get it. I need to take ownership of my health. And unfortunately, gang, I'm doing this 20 some years. We have patients come in. I just got done with a patient not too long ago who's pretty astute as far as her knowledge of, supplements. She's done a lot of reading. She's done a lot of work in the functional medicine world. And after their first day consult, when you get a sheet that's only 8.5 by 11, but it's full of things to do, totally overwhelmed. So even though I give you this plan, the plan is you're going to need some help with it. That doesn't mean us, right? So find somebody that you trust, and you really, really trust, that understands this full gamut of the full 4 pillars to walk you through step by step. 20 some years in it. I'm just figuring it all out myself. So you're probably going to need help. And again, that's not promoting the clinic. I don't want to do that. That's not my plan. But I do think in order for you to get from point A to point Z the right way, with you maximizing your upside the most, it's very, very difficult to do on your own. So I always wanted to mention that. So so hopefully all that makes sense. Hopefully you've got a good foundation. Dr. C just walked in. So let me pull up the PowerPoint for you. So this is Dr. Connealy.
Hello, good evening, everyone. Welcome. I'm glad you're here learning and educating and informing and empowering yourself because, this for us is a labor of love because, we have the privilege of seeing patients every single day, 5 days a week. And we want everyone to know what we know. And that's why we do these conversations. So you have a platform and that we can really spoon feed you really everything that we know. And, my whole life, because of my story, and if you don't know my story, there's lots of different areas. I've lived my whole life learning how to prevent all diseases. Cancer was my number one because my mother took a drug when she was pregnant with me. And I found out at 16 years of age that the drug my mother took with me caused cancer in both male and female offspring, as well as hormone problems, anatomical, hormone, infertility, all kind of things. And one day I'll tell you my whole story.
And by the way, gang, we're going to pull up the PowerPoint in just a second. I haven't done it yet. I wanted Dr. Connealy to do a nice intro.
And so I spend every waking moment learning the latest, greatest thing to change how we do things here, but also to let everyone know what we know. And, we cannot build Rome in a day. I always tell patients it takes about a year by the time that you start with us to really learn and master everything that you're mastering your miracle. That's what you're doing. You're mastering your own miracle so that you get to live in the best place possible. And Dr. Roney and I, we live it, breathe it every single day because if we need to show up for the best version of ourselves for you. Okay. And I teach all my doctors, if you haven't done everything you're telling a patient to do times 10, then you can't be a good doctor.
That's great. That's great.
And so every day I do a procedure here. I have infrared sauna here at home. I do green juice every day. I do vitamin C every day. I live and breathe this because when I'm 85 and 90, I still want to be teaching you guys. And so I'm just happy that we have this beautiful people that want to learn because, I had a patient today from Arizona and she was telling me today that they constantly he has prostate cancer and she has Hashimoto's and a few other things, but they've completely turned their life around. They are 100% better than when they came. They started with us May of 2021, I think. And now we're approaching, I had their phone consult today, but their whole life is 100%. And he's 75 and she's, 60 something. So anyway, it's a true commitment to yourself, but it's not really optional. It really isn't. This isn't something, because what I will tell you, and we're talking about cancer tonight, that Nixon declared war on cancer 1970, and every president subsequently has declared, we've got to do something, we've got to do whatever they say. How much better have we gotten?
Statistically?
Terrible.
Right.
The statistics are terrible. Okay, 1 in 2 men, 41% of females. And the last 4 months, we had our doctor meeting last Wednesday. We have it every Wednesday. And we talked about in the last 4 months, I've seen a dramatic increase in 25 to 40-year-old patients.
Yeah.
That's what I'm predominantly seeing.
Yeah.
So I used to say that there was a warranty until you're 40, but now, hi, Erica. Great to hear. I'm glad you're here with us. And, you know, I used to say you had a warranty until you're 40, and I can't say that anymore. All right. And because what we're seeing every day, I see a brand new young patient. Today, I had a 30-year-old with brain tumor and a very, very bad pathology. So we got to change. You got to change the things for yourself. You've got to, hi, Jennifer, we've got to change for yourself, for your family and your loved ones and your community. Just think the heroic nature of this nation if we all just helped each other show up to be the best version of ourselves, okay? And that's why Dr. Roney and I love doing this. We want to continue doing this, and we will share everything we know, because self-care is going to be the new healthcare, guys. We can't rely on ERs and hospitals. You need to rely on your own self-reliance and your self-empowered health. So with that said,
we talked real quick.
Okay.
I told them about healthcare in America is really sick care. We talked about the medications consumed. We consume 66% of all the medications. We talked about the $1 trillion plus that we spend on healthcare, yet we're one of the unhealthiest with the highest rates of heart disease, cancer, strokes. We went through all that and discussed it's a sick care nation. It's not healthcare. What we're teaching you, though, is healthcare, and it's active care. It's not passive. Passive is you go to the doctor's the superstar, and they tell you, you do this, and you go home and basically take a pill. That hasn't worked. It'll never work. Right?
Right.
What will work is you becoming actively involved because you understand how to, which is part of the class. Is that fair?
Right.
Yeah. So we want to teach you what we learned, and then what we feel when we made the changes and made the difference, and the confidence in our health is a big part of it too. So let me pull up the PowerPoint, gang. Let me see here. There we go. Okay. So the first slide, and I went through a full review. So just to make sure.
Okay.
Yeah. Let me just make sure here. Okay, so the first one I want you to talk about is ozone. So we talked about pillar 2, killing and starving. We talked about that last week. And this week I want to talk about the oxygenation and alkalizing part of this.
Okay, so ozone's been around for a very, very long time. It's utilized all over the world. Ozone can be administered intravenously, and it can be administered vaginally and rectally, and topically too, because for people with abnormal pap smears, I will use it. I'll have them give it in a jar and use it topically. And like for healing of wounds, like if you have a surgical scar, we use it for healing of wounds. So O3 is ozone, and it's super oxygen, okay? And oxygen, what this does is it adds very potent oxygen to your system, depending on what administration. Number 2, it kills viruses, bacteria, fungi, and cancer. Number 3, it neutralizes the toxicity that we're all exposed to every day. It basically neutralizes the chemicals. Then number 4, tremendously helps the immune system. Now, the other thing we use it is it's synergistic with chemotherapy. So we add it to our chemotherapy regimes because it makes the chemo work better. Oxygen always makes the chemo work better. And then with the patients you talked about in the blood test that we do called PHI, a lot of our patients have elevated PHI. Otto Warburg got a Nobel Prize that cancer thrives in low oxygen. In fact, that's how they find cancer cells to study the effect of a medication on a drug, is they lower the oxygen to the cell and the cell becomes anaplastic, abnormal, like cancer. And so we use this as a methodology to bring down the oxygen levels. So this is a very powerful tool for patients who have chronic infections. They're getting over disease. They're doing radiation. We give oxygen with radiation because it enhances the radiation treatment 50%. So this is how we use ozone. People who like any chronic infection, it works beautiful. So you want to go to the next slide?
Yep. Yes, ma'am. So Dr. Connealy already talked about the benefits.
Yes.
So you see it there. And then, okay, mistletoe.
Mistletoe has been around for a very long time. We're one of the only clinics in the United States that utilize mistletoe. It's been around for about over 100 years, been used in Germany and other countries many, many years. There's over 30,000 clinical PubMed studies on mistletoe. Mistletoe is the plant that you're thinking about, that if you kiss under it, under the yes. Holidays. And so what mistletoe is phenomenal at enhancing the immune system. It causes cancer cell death, which is apoptosis. So this is very helpful. You know, it's another adjunctive thing to help kill cancer. You know, we can't just use surgery, and we just can't use chemo to kill and radiation to kill cancer. We've got to fortify the body with natural things that will raise your vibration, raise your energy, and have healthy cancer killing effects. And this is mistletoe. Mistletoe helps your quality of life. Like, people feel much better. They even use mistletoe for anti-aging. So this is like, let's say you didn't even have cancer. People have used it not even having a diagnosis of cancer. It also cuts down the blood supply. Cancer cells have a blood supply. So cancer starts with one abnormal cell, and it starts duplicating and duplicating, and then it anchors itself with a blood supply. And so this helps cuts off the blood supply. It also helps with a very important part of the immune system called our T cells and natural killer cells. So you have a whole community of immune cells that need help fighting for you. So this also helps that. It also helps prevent metastasis. So there's a very significant study that's showing very good results, because I happen to know the person who is conducting the study at Johns Hopkins. And it's a very favorable study, even though this is used for 100 years, but for some odd reason, the scientists in America don't believe that the people otherwise can do studies and are scientists just like America. I don't know, but it's a very frustrating thing. Because we need to be implementing things that are not injurious and not immunosuppressive. This is the opposite. It does everything to enhance and help the immune system and help the energy of the patient, help, you know, every facet of cancer. So,
okay.
So it was mentioned that mistletoe could be IV, but a lot of our patients will do 2 weeks of intravenous, and then they will do subcutaneous. So they can very easily do this at home. Okay. So this is a great thing.
So with this one, the heading on here is UVBI, which we'll talk about, but really this is the Endo Laser. Right. So we're going to talk about both.
Right.
So let's talk about the Endo Laser first.
Right.
If you're okay with that.
So you're not going to believe this, but laser that was invented many years ago, and it was an accident how lasers were invented. So actually, what happened is a kid fell down and sliced his eye with a glass, and then they noticed his vision improved. And so then that's how lasers came about. And so lasers are going to be the new treatment. Even in the United States, they're already using light as a treatment, okay? And light, I tell people, light is life. That's why we need to get sunlight every day. Because if you don't have sunlight, every single one of your cells, every single one of them emits light. Believe me, it is the most beautiful thing. A German scientist by the name of Fritz Popp discovered this many years ago, and his son is continuing the studies, but they discovered that every single cell emanates photons. Photons are light. And so when we do the Endo Laser can be applied intravenously and topically. I had a patient who had stage 4 recurrent cervical cancer. She had a lesion on the inside lining of her vaginal cuff. We did Endo Laser activated with ICG, which is a special green green substance that activates the light. And the doctor, her GYN oncologist, felt it, and you could see it on PET scan. We did that treatment on her, and it's gone. Okay, gone. And the doctor goes like, what did you do? Because what they wanted her to do, they wanted her to do radiation. Well, the patient was very, very scared of radiation because she goes, Dr. Connealy, I read so much, I don't know. What can we do? So we did all these things. The patient was amazingly willing and would do anything.
Yeah, hard worker.
Yeah, hard worker, just amazing, young, only 40 something years of age. And we got rid of it, and she is doing like, it's amazing. I mean, like I can't even tell you because
I bet she's on here too. She told me she watched.
Yeah. Oh, okay. So she's on tonight, and we're happy because, you know, we want our patient. All we want every day is our patients to get well. That's all we want. Okay.
Bottom line.
And unfortunately, patients are not concerned when they think everything's okay. But today's time in 2022, we all need to be verifying that we're okay. We can't be guessing that we're okay. We must know, and we must verify, and you have to partner with an integrative functional doctor who has some years on them.
Right.
Because if they don't have years, if they're just beginning learning, they don't know
what they don't know.
Yeah, they don't know. And I'm not saying we know everything,
No.
but I know who to call. Like if I don't know something, I get on the phone and call wherever, India, Germany, wherever we need to, and get ideas. And so, because you know what, I want someone to treat me the way we treat our patients. So anyway, going back to the Endo Laser. So light is going to be the treatment of the future. So what this light does, like I said, it's 5 different lights, okay? 5 different wavelengths of light. They kill bugs. They help your microcirculation. They can kill cancer cells. They can neutralize toxicity. They can oxygenate your body. They can kill all types of bugs, all kinds, from hepatitis to any kind of bug you want to think of, it can kill. And so
the photosynthesizer is a big one. Right?
Yeah, so we always use a light. So we always use, we always use a photosynthesizer. So they're all substances that have color. So for example, ribose is like a red color. So ribose is used to kill viruses. Methylene blue is a photosynthesizer that can get rid of free radicals, kill cancer, help the cardiovascular system, help Alzheimer's and dementia. It has like a plethora. It's a substance that's been around for about 145 years. Poly-MBA is lipoic acid, one of the most powerful antioxidants that our body makes. But as we age, or if we don't get nutrition, we need that to get rid of bad chemicals. So these are all substances. We use, there's another photosynthesizer, curcumin. Curcumin is amazing. Curcumin imitates 14 different drugs. It's very anti-cancer, anti-inflammatory. It's like there isn't anything that curcumin doesn't benefit. Right. And so what this does is we put the light in, we put the photosynthesizer. So the photosynthesizer is the activator. The light destroys the abnormal tissue. So it works synergistically. So you can actually use the light alone just for general health and well-being. I've done it myself, just without any substance. Sure. So because light is life, honestly. And what they're saying now today, that we're not getting enough light because we're inside all day, we're under these terrible, crazy lights, and we're not in nature enough. We're not getting outside enough. And unfortunately, with pollution shielding the natural rays of the sunshine, so that's why we have red light beds, we have infrared, we have a lot of different lights here. We have biophotonic light called Firefly. So we have lots of different light procedures here because light is life. So anyway, that's enough about that.
And the one thing with the photosynthesizers, right, absorbs the light and produces an active form of oxygen that destroys the nearby cancer cell. So it's another oxygenating tool as well. And again, oxygen is critical, right? Heat's critical, oxygen's critical,
And light's critical.
and light's critical. So just wanted to point that out. So Endo Laser, we use it. It's pretty much used after every IPT.
Every low dose chemo.
It's busy all day long. We have two different machines
Machines.
that are busy pretty much all day long because of the benefit of it. So that's a good one. I'll have you touch on the UBI real quick.
Okay, yeah.
Yeah.
So ultraviolet blood radiation has been around probably for 70 years. It was first approved for T-cell lymphoma probably 70 years ago. And now, so what it does is it kills all the microorganisms that are in your body. Okay, so like unfavorable organisms, whatever viruses, you know, like head and neck cancers, there's 50% are related to HPV. Okay,
Right.
Rectal cancer is related to HPV. A lot of cancers are related to Epstein-Barr, cytomegalovirus. So there's a lot of viral connection to cancer. Why? What happens is the virus wears down the immune system, and you get free radicals, you get inflammation, you get production of toxicity, and so you have this environment for cancer. So, you know, cancer, I always say, is 100 leaks in the roof, and it's a tornado, rainstorm, and hurricane, and you got to seal all the leaks off. That's why you can't just do surgery, chemo, and radiation. And any doctor who tells you that, unfortunately, I would love cancer to be so simple. If that is so simple, why are cancer rates so high, and why is the survival rate at 2%? So
right. Perfect. Okay, so this is a good one, the alkalized IV.
Yeah, so everybody talks about alkalinity in their urine, their saliva, and their blood, but what's most important is your tissue pH. Tissue pH is where everything's happening. And why are we acidic? I would say the number one thing is stress. Okay. So if you're stressed, and I remember when I worked at the VA and I learned how to do arterial blood gases, and those are done on people who are very ill, and it's all checking the pH. It checks the oxygen and carbon dioxide, but it checked the pH of the patient's blood, their arterial blood. And we knew if the pH got low, oh my God, it's an emergency. We got to juggle and do all different things. And so it kept an indelible mark in my brain about acidity. So when we're acidic, we're sick. Okay. Yeah. So that happens. I would say stress, toxicity, poor nutrition, free radicals, bugs, viruses, bacteria, fungi, and parasites. And don't think you don't have them, you guys, because I work here and I get checked on a regular basis with Molly, who you'll meet in one of our conversations. And I tell people, it's not you're so bad. The world around us is not good. It's not kind, unfortunately, in the world we're living in today. They have last meeting at the American Academy of Environmental Medicine. No speaker talks to one another. They all said in their conclusion, on their topic, one was plastics, one's on heavy metals. They all said that pollution is our number one problem. Now, I will tell you our number one problem is stress. So stress and then pollution, I would say.
We're just inundated.
Yeah,
right.
It's a very, very different world. So anyway, so we use this, we give people things to do themselves with detox, sauna, baths, detox baths. We have them do green juices. We have them do something called pH adjust to alkalinize their tissues. And then we have a very, very special IV that we use to alkalinize, and it's all natural things to alkalinize the blood and tissues. So it's critical. You can't measure your own pH because we're talking about the pH of tissues, not of blood, urine, or saliva. So anyway, so that's what we do to help people. One of the best things you can do to alkalinize your body is cleanse, get your mind in the right, set your mind with a positive mental attitude. No matter, you need to lead life with dignity and love and kindness. We all need to, no matter what's coming your way, we just need to live with dignity, integrity, and love and compassion to humanity, because there's just no other way. Anyway, so let's go to our next.
Yeah. So what I want you to do, methylene blue. I want you to touch on that one because that's a biggie.
Right. So methylene blue, I've known about for a very, very long time. And like I said, it's been around for 145 years. And I first started using it to for my brain and cognition. And then I use a special spray on my body. It's methylene blue with a shielding of minerals because I'm very sensitive to EMFs. So I spray it on my body front and back every single day.
And I've seen her do it.
Yeah, so methylene blue is also an amazing, I mean, amazing product for, we use liposomal and we use it intravenous. We use it intravenous for the cancer patient. There is absolutely no complications, no downside that I've ever seen with methylene blue. But one of the most important things we use it for, because it is effective at killing bugs, viruses, fungi, bacteria, and parasites, all of those. So it's very hard to find something that's non-toxic to kill all those bugs, but it's amazing at getting rid of the free radicals. Free radicals are the constant chemicals we all make. Every one of us makes free radicals every day, and it's just very hard to continue to combat these free radicals. Then, like anybody, you want to help cognition. So anybody who wants better memory, and they're finding dementia in 25-year-olds, you guys. So this is the children, the young children are the canaries in the mines telling us things are not right, okay? And we as a mature, wise adults, we need to all take a stand for ourselves and each other. Anyway, so methylene blue also is amazing at cardiovascular benefit, so heart benefit. So there's absolutely just no downside to using methylene blue.
Okay, we're almost done, but I want to have you just touch on again hyperbaric, just because we're talking about oxygenating the body. We did it a little bit last week, but I think we'll finish with this one, and then we'll get to some questions.
Okay. So hyperbaric, again, has been used all over the world, the least here, but it's rapidly growing. Now they have so many great international conferences now. I spoke in Florida, like, how long ago was that? 4 months, 5 months ago? I went to Florida and spoke on hyperbaric and cancer and other things, because we use hyperbaric for patients who are going to have surgery before and after their surgeries. Plastic surgery or cancer surgery, they all get hyperbaric before and after. The healing is 1000% better.
Oxygen.
Yes, oxygen. Oxygen is the first thing you need to stay alive. You die in how many minutes? 4 minutes?
It's a short period of time.
Short period of time, less than 5 minutes, without oxygen. So the first thing we need to do is all be mindful of our breathing. Take deep breaths. I do Wim Hof. If you've ever heard of Wim Hof, I do Wim Hof. I have 11-minute a breathing exercise on YouTube that I use, and I do that because that helps my nervous system and helps breathing. Of course, I exercise, but I did hyperbaric 3 months before my back surgery, for 3 months before and 3 or 4 months after my back surgery, because I had an 18-hour back surgery. So it phenomenally helped my healing phase and healing cycle. I feel like I'm still healing, but anyway, so you can't, hyperbaric is amazing because again, we test that blood test, PHI tells me that if you have anaerobic environment, which most patients do, I won't say every patient, but most patients do. So we use hyperbaric and or ozone to, flood the body with oxygen so that it can heal.
So one thing I'll mention before we get to the questions is the 4-pillar approach, right? It seems simple. It's like, oh, we do testing, and then we do the killing and the starving and the oxygenating and alkalizing, right? And then we do the immune boosters, which we'll talk about, and then all the causes, right? Think about that. How long has it taken you to learn all of that? I mean, honestly, you're still learning, and you're still learning. So the point I have patients that come in again, and they'll say, oh, I'll figure it out. I can figure it out. And then they go to the console and they get 1 page. I said this earlier, and there's maybe 15 things on the page or 10 things or whatever that they could do. and they're totally overwhelmed. The point I'll make is, and you made it earlier, find somebody that understands this really, really well to help you guide through the process. You're going to need it. I'm 20 plus years in, and I'm just feel like I'm anchoring and convicted to the plan and the process. So there's a lot, right? Because you learn all this and you could Google a million things. And you're like, well, what do I do? How do I, you're going to need somebody to really steer you in the right direction. That doesn't mean us here, although we do a good job. That means you're going to need somebody, right? Find somebody to help you go through that process. Now, I wanted to mention that. It's just there's too much.
It's too much. And we don't expect you to do this overnight.
Right.
First of all, there's no finish line to health, number one. Number two, to learn this, like I said, takes about a year. So I know we can overwhelm you with information. Implementation and execution is another story.
Exactly.
So that's why I want to encourage you to take one little step at a time. And probably the first thing is take inventory of yourself, of what things you maybe need to change. Like, take inventory. How am I sleeping? Am I sleeping 8 hours? Am I drinking the water that, you see me drinking the water because I didn't drink the water this afternoon because I had emergencies this afternoon. So I didn't get to drink my water. And so then what am I putting in my mouth? Is every morsel of my food enhancing and providing the necessary information for the biochemistry of my body? Am I moving my 800 muscles? I mean, just anything. Like I walk up and down our stairs all the time because if I don't get time to exercise, I make sure I incorporate it in my workday somehow, some way. Every time you get up and down, it's movement, and that's why I have found the joy in washing dishes, believe it or not, because I'm standing up, I'm exercising.
That's a good, it's all perspective, right?
Yeah,
it's
exactly.
a good way to look at it. Well, you said something last week. You texted it to us. It said schedule time for your health.
Oh, I told them, I sent them a text to our group, and I said, if you don't schedule your health, your illness will schedule you.
Right. I thought that was profound. Yeah. I text back and said, we're going to use that all the time. Yeah. I love it, but it's true, right? It's true. So, all right, let's
go to questions.
Yeah, let me get out of here. And then, okay. All right. So we got a lot. All right. So let's pull up some here. Fast, water only, juice, veggie smoothies. So Corey. Hey, Corey, by the way.
Okay. So that's a good question. So I recommend lots of people to do fasting. And so if I have a patient who is high sugar, high inflammation, they have cancer, and I will tell them to go on a fast. And everyone always asks me, so what do you mean fast? Like don't eat? And I go, yes, exactly. You don't eat. Okay. So you would just do a water. So they say how long? She says we're not sharing our slide.
We're out of the PowerPoints. Now we're doing Q&A.
Oh yeah, right.
So,
right.
Yeah.
Okay, Fadia. Hi, Fadia. We can maybe we can try to get them or something.
Yeah.
So okay. Anyway, Erica, I'll get to you in a second about your chlorophyll question. Anyway, so fasting. So whatever the patient thinks they can do. The longest I've ever had a patient fast is 30 days, and they shrank their tumor to, it was a patient who came to see me for a second opinion. They were going to remove their bladder. He went on a fast. They went back in there and there was nothing. So, and I had him do many things during that 30 days. He said, I'll do anything. And so he did. So he says the slides were never shared. Oh, Sharon, I'm sorry. Well, you know what? We can send them out.
Yeah,
we'll send them out, Sharon.
We'll figure it
so
out. Sorry I don't know. I gotta figure out why. What happened? Now I'm nervous. Okay, we'll figure it out.
We'll figure it out, and I will promise we'll share.
Yeah.
Anyway, so Corey, going back to the fasting. So fasting can be very beneficial. It's the fastest, most inexpensive way to create autophagy. Autophagy is getting rid of garbage and things in your body. So I don't like people who are thin to fast. So if you're thin, forget fasting, okay? So if you have 10 pounds, 20, 30, 40, 50 pounds to lose, fasting is good, but not too long. Okay, I don't recommend too long or too prolonged. The patient who had the second opinion for bladder, I mean, he had lots of weight to lose, so, and he didn't stop exercising and he didn't stop taking care of himself. And then I put him on certain supplements at the time that, you know, to keep his sustenance and everything else, and also kill cancer. So now, water only. I tell people to do water or bone broth, or they can do a juice fast, like they could do 4 green juices a day. So whatever you think you can do, but it's not something that you're going to do like forever and all the time. Usually it's to jumpstart a very, very serious situation. And if you're thin, forget about fasting. I won't do that. So the next patient was how to lower alkaline phosphatase level. Well, alkaline phosphatase is an enzyme of your liver and bone. So you got to first act, you have to have the doctor to order blood tests to see, is it blood? I mean, is it liver or is it bone? And then you got to make sure you should have an abdominal ultrasound. So ask your doctor to get an abdominal ultrasound. And then you may need liver support. If you have, I don't know if you have Karen, I don't know if you have a history of cancer. If you have a history of cancer, we want to make sure there's no evidence of any bone metastasis, because if you have bone metastasis, it will raise your alkaline phosphatase. So, so I would need, you know, that's a question that you got to take everything into context. And, you know, again, I watch my patients very vigilantly, and I look for things to always get back to normal. Now, if you have bone metastasis, it's going to tend to be high. And the worse the cancer gets, unfortunately, the alkaline phosphatase will definitely increase.
And gang, real quick, I know the slides, something happened with the slides. We'll figure that out, and I'll make sure we get those to you. So no worries there. Okay. So just wanted to let you know. Let's see, replay of the first session.
Katie.
Yeah. Replay of the first session. Yes. Anybody that signed up can get the replays. So we'll make sure we do that.
Okay.
So Nagalase, right, to lower. Do we ever use salicinium for sure?
Yes.
Right?
Oh yeah. We use salicinium in our protocols. So yes, we use something called Bravo suppository, so that you can call the store and order that yourself. It is a suppository that you use rectally every other night. Yes, we use salicinium. We load the patient intravenously for 2 weeks. We'll talk about salicinium in a future conversation, but we will use salicinium IV for 2 weeks, and then we put you on oral. So that does lower Nagalase level. Trying to avoid brain surgery for brain swelling, edema, and tumor in the brain. Well, you may have to have surgery. I don't know, Stephanie, your particular situation. You know, we do with a lot of patients with brain metastasis, and sometimes, you know, they may have to do brain surgery and or radiation depending on the situation. You know, I know that there's, you know, things you can take. I don't know what kind of cancer you have or anything. But you know, that's a tough question. Yeah, and I'd have to know the details of the situation on this. So, all right, Marlee Perry, what is DIM used for? Well, DIM is a agent that I've been using for about 25 years. So I use it for abnormal pap smears. I use it for better metabolism of estrogen, which both male and females benefit. I use it for abnormal cervix, like people who have cancer. I use it for cancer. So I use it for HPV. I use it for a lot of different things, and I've used it for a very long time. I love DIM.
B3?
Well, this is stage 3 ovarian cancer, B3, you know, that niacinamide, I'm not sure, you know, there's many things you can use for ovarian cancer, okay? Many things. So niacinamide, I mean, I'm not sure if it would be like one of the top things I would use, okay? Probably not something the top things I would use, okay? B3 can be beneficial for a lot of things,
Yeah.
okay? But
That needs a full plan,
yeah,
honestly. Like
yeah.
a stage 3 needs a full
Full,
plan.
you need a
4
full,
pillars,
yeah.
start to
And
finish.
circulating tumor cells, what's your PHI? What I
Right.
mean, all these things. Did you do a cleanse? I mean, all these things. So, you know, you got to peel the onion. You
Right.
didn't create a 10-year earthquake and get it cured in a week or 2 or 3 or a month or 2. You know, it's you know, cancer is a 10-year disease that's been brewing, simmering, fermenting, and to change that unwell garden takes time, you guys. There is nothing simple about cancer. If there was, the cancer rates would have been decreased in the last 50 years. What do you recommend to a home to increase oxygen? Okay, first of all, breathing exercises, like I just mentioned, Wim Hof. Exercise an hour a day, and like walking and, you know, lifting weights, that kind of thing. Then we use something called chloroxygen. It's a very potent chlorophyll. And pretty soon I put an order, and I just ordered a special oxygen water that I don't have yet, but I will have in the next, you know, let's see, what's today, Wednesday. So probably Monday I will have. So I can get you that. If you call Perfectly Healthy Store, they can get you that, and that will be a phenomenal thing for you to have and drink at home.
I think there's some questions that I see popping up about specific cancers. And I just want to mention the whole concept of the class is about 4 pillars, right? It's about the right testing, the right treatments, you know, starving, killing, oxygenating. It's about immune boosting, and it's about finding the causes. That's going to be the answer. Am I wrong? For everything.
Yeah.
It's not a one silver bullet approach. The 4 pillars is how you're going to give yourself the best chance. And that could be within pillar 2. It could be chemo and radiation and surgery, right? It could be low dose chemo. It could be some of these things that we're talking about, but it's not one thing.
Right. And you may need surgery. Yeah. Okay. The patients need surgery, but we want to prepare you mentally, physically, emotionally for surgery. If you need chemo, if you do conventional or low dose chemo, we want to prepare you and take care of you. If you need radiation, we want to prepare you and take care of you. You can't just do the treatment. You got to take care of the patient while they do the treatment. That's the difference.
Right. Right.
Okay. The talks online are available online. I think they are.
We send replays. Yes. We send replays. Online consultations, having all the tests.
Yeah, we can do online consultations. We always encourage our patients at some point in time to do a 3D visit. And because we do bioenergetic testing and the patient needs to be here. And what I've learned, you know, I've always been doing for years, phone, and before I did Skype, before Zoom. And I'm always amazed at when I physically see the patient and examine the patient. I'm always like, oh, wow, I would have never captured this in Zoom or a phone call. So, you know, you can't capture a 3D patient, you know, via Zoom. Yeah. You just can't. I'm sorry, you know.
Right. It's hard.
And then she said, what did the patient say? I missed
just about the online consultation, having all the testing.
Yeah, right. There was some other lady, I missed it. So.
Well, those will pop up last on this one. So let me.
Oh, okay. So it says here, do you have to repeat the Rgcc test? Yeah, we usually do it 9 months to a year. You know, I usually.
At least the circulating
tumor cells. Once I get that part of it, I will put you on a protocol of a rotation of supplements, and then I'll check it in 9 months to a year. Okay. Because the goal is 0 to 1. Okay.
Higher dose IPT?
Yes, we do. Yes, we do. Yes, we do that. If we think the patient needs that, we will go up on the chemotherapy.
We might start lower and then work our way up depending on the reassessment process. So,
of course, we put all of our patients on organic food and no GMO. Of course, that is a given, Susan.
Yeah, definitely. Is there a way to access the previous discussions? Yeah, we'll figure out.
Yeah, I don't handle, but I can ask our
You know,
tech
so
department.
IT department to figure that out. Previous calls, this is great. Please
So
access
in
previous
place of a
classes.
yearly mammogram, instead of a thermography, should one consider an ultrasound? Absolutely. Absolutely.
Mm-hmm. MRI, ultrasound, right? Anything. EBO2 ozone, how often? Or can and should? How often can should?
Let's see. For IV ozone, I usually do 1 a week for like 10 weeks. So.
All right, let's see. Stay away from type of antioxidants while in treatment. That's a question we get all the time.
Okay,
so starting chemo, antioxidants.
Yeah, so I'm starting chemo in March for HER2 positive. My oncologist is recommending I stay away from any type of antioxidants while in treatment. Well, that is the opposite answer that we give our patients, okay? Because you are going to be taking significant drugs that are going to create outrageous free radicals, outrageous acidity, outrageous immune suppression. So how are you going to take care of you if you're getting all these drugs and not taking care of the patient daily? So I can send you a great paper if you write a note, Dr. Roney. I'll send you a great paper that was written by a radiation oncologist from Memorial Sloan Kettering that you absolutely need. You need nutrients when you're undergoing treatment, but they all tell the patients that no matter what you have, cancer, high blood pressure, anything, they think everything that causes the problem is natural. And I'm like, well, there's no body that's died of an overdose of vitamins. So, let's see, how often should I patient do ozone treatment? Yeah, well, IV I do once a week. Rectal I'll do a couple of times a week.
Rgcc,
okay.
we talked about that one. Liver enzymes elevated, I don't know.
So it says here, like, is Rgcc needed again if there is a reoccurrence? And well, first of all, you need to be concerned that you have a reoccurrence, number one, because your doctor should be making sure you don't ever get cancer again. So, so the first thing would be to, if you have a reoccurrence, you need everything done. You need to figure out why you didn't, why is this reoccurrence happening? So.
All right, so we're almost out of time. Last one here. Sorry.
Some of my liver enzymes are elevated, alkaline phosphatase and GG. Possibly do the treatment with cadicola. Yes, yeah, exactly. What should I? Oh, yeah. So what you should be doing is, so I use something called, you can call the Perfectly Healthy store. I use a liver sauce. I kind of rotate. I take something for my liver every day because there's too many toxins.
Right, me too.
So I take a liver sauce, or I take Ultra Liver Support, or milk thistle. So just call the store and tell them what you need to do. Plus, I would be doing liver flushes once a month. So with the, in my book, it talks about how to do it. So you start with Vitality C and Epsom salts. The girls at the store can send you their directions and tell you what to do. They all done cleanses. They've all done it all. So, oh, Sharon loves a liver flush. Yeah, you go, girl.
All right, gang, it's 20 after. We have a meeting at 6:30.
Yeah, I love oil pulling, love dry brushing, love all that. So you guys, I'm glad you guys are empowering yourself with this information. Share it with your family, your friends, everyone, so they can be empowered with their health.
I think, gang, I think I know what happened with the slides. I think I hit here instead of going to share screen.
Oh.
But what I'll do, that's my fault, right? Information was still good. So what I'll do is I'll go back and I will retape, I'll redo this, not necessarily with everything, but at least the slide portion of it. So at least you can correlate. So I'll take care of that, I promise. Okay. And that's maybe my fault. I got to figure that out, but I think that may be what happened. Okay. So real quick, let me give you, as I tell you, I'll do every time.
Guys.
Yeah.
We appreciate you too.
I'll give you, if anybody wants to, let's see here. You see, I think I got these now. Sorry, gang, give me 1 second. This slide. Okay, so the websites, right, for the Cancer Center for Healing, the website is cancercenterforhealing.com. If you need any information, there's a lot of great information on there. The phone number is 949-867-6374. You see it here. I think you'll be able to see the screen now. So that's my fault. And then the supplement store, 949-997-0821. And then Center for New Medicine. So if somebody wants to just do
prevention and early detection, or just want to make sure they don't have diabetes, they don't have autoimmune, they don't have fatty liver, they don't have, you know, any chronic medical health condition.
Yeah,
So
that's the 949, it's 867-6419. And the website is cfnmedicine.com there. So I'm almost positive you can see the slides because we're up here and that's what should have happened.
Again, so we'll make sure you get slides. I promise.
I promise. Yeah, I promise, gang. There was a lot of feedback on that. So, okay, have a great week. Much love to you all. Join us next time. We're going to talk about the immune boosters, and then we're going to get into the causes, right? And that's a biggie. So, so don't miss that. We'll send out emails. We'll send replays. I promise you, you'll get everything you need. Okay.
All right. Thank you. And
bye,
please
guys.
Send us your suggestions, comments. We don't take anything personal.
No, for sure.
All right. We love you.
Much love, gang. Have a great night.